If you are a breastfeeding mom or a soon-to-be mom, please don't skip this video for anything, because this particular video is for you. Let me tell you something. As natural as the breastfeeding process is, challenges can sometimes arise. And when this problem surfaces, they may grow worse quickly. Yes, you heard me right. When the problems surface, they may grow worse quickly, and they can interfere with your milk production and also your baby's ability to get adequate nutrients. That is why it is very important for you to get help immediately you notice any of these challenges I'm going to be sharing with you. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today on this particular video, I'm going to be sharing with you 11 signs of breastfeeding problem, so you as a mother can stay alert and also contact help when needed. So the first sign of the breastfeeding problem I'm going to be sharing with you is your baby's nursing section is either too short or too long. So if your baby is nursing or latching on your breast for a short period of time, it's not even up to 10 minutes, especially in the first few months of life, that could mean that your baby is not getting enough milk. And if your baby is latching on your breast for a long period of time, 1 hour, 30 minutes, that might also signify the fact that your baby is not getting enough milk. So you need to speak with your midwife or your healthcare provider in regards to that. So the second sign of breastfeeding problem I would like to share with you is after the nursing section, your baby is still hungry. After sucking for a particular period of time, you still hear your baby crying and wailing. That baby is still hungry and needs more food. It could mean that the baby did not get enough milk during the period of nursing or during the period of breastfeeding. So you might need to seek an expert help, or you might need to speak to your midwife at that particular moment. The third sign of breastfeeding problem I would like to share with you is your baby frequently missing nursing section, or your baby is sleeping throughout the night. Let me tell you something. If you are a mom and you have a newborn that is sleeping throughout the night, that is a big problem. We all know that newborns are to keep us awake all night. Don't go about saying my baby is not stressing me, my baby sleep all through the night. No. That is a problem that needs to be talked out with your midwife. Yes, you heard me right. So if your baby is frequently missing nursing section, it's very important for you to speak with your midwife or your healthcare provider. That is a breastfeeding problem. Then the fourth one I have to share with you is if after 2 weeks, that is your baby is 2 weeks old, your baby is still under his birth weight. You heard me right. For example, your baby weighed 3.5 kg at birth, and after 2 weeks, your baby is still weighing 3.3, 3.2, then there is a breastfeeding problem. If your baby is reducing in weight after 2 weeks, then that's something you need to speak to your midwife about. Then the fifth point I would like to share with you is you don't hear your baby swallowing. Yes, you don't hear them swallowing. Swallowing is a good sign that your baby is getting a lot of milk. So if you don't hear your baby swallowing, there's a possibility he's not getting anything in his mouth, so there is nothing to swallow. At the beginning of every nursing section, you are going to hear like swallowing occasionally. You're not going to hear it frequently. But as the breastfeeding section goes, you see the swallowing increases. You'll now be hearing it more. Then close to the end of your feeding section, the swallowing decreases. So if you are not hearing that, then there's a problem with breastfeeding. It could mean that your baby is not getting enough milk. Then the sixth point I would like to share with you is sore breast, engorgement of the breast. When your breast is swollen, it is hard, it is firm. It is known as breast engorgement. So what I would advise at this particular moment is if you can hand express, kindly do. If you can use the electrical pump or the manual pump to actually express the breast milk out, kindly do. That will reduce the engorgement, it will reduce the hardness around the breast and make you feel more better. Then the seventh point I want to share with you, the seventh problem I would like to share with you, is the fact that even after breastfeeding your baby, the breast remains hard, the breast remains firm. It could mean that your baby is not getting the milk. It could mean that the duct that is bringing out the milk is blocked. So despite your baby trying to suckle, the milk is not coming out. So the breast remain engorged, the breast remain hard, and the breast remain firm. So if after breastfeeding section, if after trying to pump, the breast still remain hard, that is a problem and you need to speak with your midwife or your doctor as soon as possible. And the eighth problem in regards to breastfeeding I would like to share with you is your baby is having less than 6 wet diaper and 4 stools after 7 days. If after 7 days of giving birth to your baby, you don't even change your baby's diaper is not wet, and the diapers that you change is less than 6, then that's something you should discuss with your midwife about. I remember coming back home after delivery, my midwives kept asking me whenever they visit, how many wet diapers did you change in 24 hours? How many wet diapers do you have in 24 hours? They're going to ask you these questions, and that gives them a clue if your baby is breastfeeding properly or not. Then the ninth problem I would like to share with you is painful breastfeeding. So if you are breastfeeding and you are experiencing pain, that could signify that your baby is not latching properly. Your baby is not attaching to the breast properly. I've made previous video on that. You can watch our video on how to latch properly on the breast. That's going to give you a clue, and that's going to help you position your baby to latch properly. Then the 10th problem I would like to share with you is after 5 days, your milk has not come in. You don't experience that fullness. Your baby is trying to suck, but you notice that you don't have that feeling that something is coming out of the breast. It's very important for you to speak with your doctor about it. You heard me right, okay? Because if you notice it, if you felt it, it could mean that you are not producing enough milk. Then the last one, which is the 11th point I would like to share with you, is what are you facing as a mother when it comes to breastfeeding? I would like to know, what are your challenges? What do you think is affecting you? The level 1 is going to be what you are going to tell me and not what I am going to tell you. All right. So these are the challenges in regards to breastfeeding I have to share with you on this video today. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.